For individuals living with sickle cell disease or those supporting them through organizations like Act of Random Kindness, understanding the intersection of diet and pathology is transformative. SCD is not merely a blood disorder, it is a state of chronic inflammation, high oxidative stress, and hypermetabolism. One of the most significant findings in SCD research is that patients exist in a hypermetabolic state. Because the lifespan of a sickled red blood cell is only 10 to 20 days, compared to 120 days in a healthy individual, the bone marrow must work at up to 5 to 10 times the normal rate to replace them. The American Journal of Clinical Nutrition indicate that children with SCD have significantly higher resting energy expenditure than their peers. Nutritional education teaches patients that they require a higher caloric and protein intake than standard dietary guidelines suggest. Without this knowledge, individuals often face protein-energy malnutrition, which leads to stunted growth and a weakened immune system. Research has long established that folate deficiency in SCD patients leads to megaloblastic anemia, worsening the symptoms of the disease. Education ensures patients know to prioritize legumes, leafy greens, and fortified cereals to keep up with the bone marrow's demand. Teaching patients to identify zinc-rich foods like pumpkin seeds and lean meats empowers them to bolster their immune defenses, as infections are a primary trigger for sickling episodes. The consumption of magnesium-rich foods like almonds, spinach, and dark chocolate to maintain cell volume and fluidity in the blood. Dehydration increases blood viscosity thickness. Thick blood moves slowly through small capillaries, allowing more time for oxygen-deprived RBCs to sickle and clog the vessel. Education helps families transition from pro-inflammatory fats, like certain processed vegetable oils, to anti-inflammatory fats, like olive oil and fatty fish. Follow us for more.